All right, I'm joined with Derrick Cuenca, CEO of Lake Granbury Medical Center. Derrick, you just finished speaking about all the good things that are going on at Lake Granbury Medical Center, and also about healthcare exchanges and how that's going to impact people here in Hood County. But first, let's talk about the new things that are happening at the hospital.
Well, the new things that are happening at the hospital, I mean, we really have a tremendous amount of technology, but we just added some new service lines, a dialysis program. For the first time ever, we're providing dialysis services so patients don't have to leave the county or the surrounding counties to seek out those services. But also, we're adding another medical office building. It's about 40,000 square feet, about $7 million. We partnered with the Skiles Group in order to do this and another development company. But it adds a tremendous amount of footprint to the campus, but it also adds an opportunity to add services to the hospital.
You know, a lot of people think when they talk about economic development and they're looking at, oh, well, that's new industry, or that's new this, or that's new this, but in truth, healthcare is a big economic impact too to Hood County. Not only in the facilities that the hospital is bringing, but as you say, the new physicians and everybody else that we bring to town.
Oh, absolutely. I mean, the hospital in itself is a tremendous economic driver. I mean, we recruit a tremendous amount of physicians to the community, and for every one of those physicians, it requires highly trained personnel to support them. So about 2 to 3 in their office, and then usually about another 2 or 3 in the hospital once they get ramped up. But in addition to that, when it comes to economic development, employers, workforces, industry, when they come to a community, one of the questions they ask is like, well, how are you going to keep my workforce healthy? And part of what Lake Granbury Medical Center does is provide that quality service to make sure that we're going to keep that workforce healthy. So we can answer that question confidently in Hood County and in Lake Granbury, that when a company comes here and is like, hey, I'm looking to put my company here, where do I get healthcare services? Are they going to leave for the day? Well, the answer is no. I mean, we have the healthcare services here. We continue to expand that footprint in the community to make sure that we're supporting all our business here.
I know that Lake Granbury Medical Center is part of a large corporation, Community Health Systems, 133 hospitals, fixing to expand to almost 200 hospitals. And part of your role as the CEO is to basically take the message to your employer, to Community Health Systems, and say, guys, the growth is here in Granbury. We need to continue to invest in this hospital, in this community, and begin and continue to expand it. And that has happened throughout the last 15 years that you guys have been here.
No, that's absolutely the message. I mean, part of my job, I'm committed to this community. So I'm part of a large corporation, but at the end of the day, I live here, I get health care here. The businesses here take care of my needs for my home and my family. So I'm delivering a message that we need to continue to support this community, and if we do our job, then we're going to allow this community to grow and flourish and become bigger and bigger every year.
And you know, it's the 500 or over 500 now employees at Lake Granbury Medical Center that they go and they eat lunch every day, and they go and they go to the grocery stores, and they go to the football games and everything else.
They do it all. We have a very young medical staff, and with that young medical staff comes husband, wives, family, kids, and also parents. We have a tremendous amount of doctors that have actually moved their parents here as they've taken on positions here in the community and established their practices. So, like I said, one doctor could mean 5, 6, 10 extra people into the community, but also jobs, economic growth, people spending money in Granbury.
Well, and the other part of your speech today, we're talking about the newest thing, which is healthcare exchanges, and irregardless of your political views on healthcare exchanges, you are it is the law of the land, and it is October 1. We're going to have healthcare exchanges. People are going to have to make choices.
That's correct. I mean, at the end of the day, the law was passed, and in our country, the law is the law, and it comes down to executing that law. So whether we like it or not, it's in effect, and it's going to take place. So my job as taking care of the hospital and making sure I'm taking care of the needs of the community from a healthcare standpoint is to make sure that we're prepared as a hospital and as a community to make sure that we can get the people enrolled and follow along with the law. Healthcare is going through a tremendous amount of change. It's certainly going to change even more. But if we can't sit idle, I think we need to be proactive in terms of how we're going to approach it. And as the laws change and as change happens, and it's a fact of life, change happens, that we need to take a proactive stance on it.
Now, the state of Texas is not going to participate in the Medicaid program from an administrative perspective. They're going to leave that up to the federal government, which means now we're going to have what you call a healthcare navigator for this individual mandate. I am required as an individual to have insurance. If I don't get it through my employer, or I don't get it through some other government means, in other words, Medicare or Medicaid or whatever, I'm required to have insurance. So you mentioned healthcare navigators. Explain what that is.
Well, the healthcare navigator is to help the individual go through and find out what insurance works for them. There's going to be different platforms and different tiers in terms of insurance, where from bronze, silver, gold, platinum. And that navigator is supposed to be knowledgeable in those particular delivery and those types of coverage, and they're supposed to help that individual consumer make that choice on what works best for them and their family from a financial standpoint and from a coverage standpoint. Obviously, a 25-year-old healthy adult doesn't probably need the same level of coverage as maybe a 56-year-old adult.
And the other big thing that you mentioned several times as you were giving your speech was that pre-existing conditions and refusing people on health care, those are not options anymore for insurance companies.
No, that's part of the Affordable Care Act. It's part of the law, is that they cannot deny coverage for those individuals. So the premiums, as I understand it today, if you're choosing the bronze coverage, you're not going to be denied, or if you choose the silver coverage, you're not going to be denied, and those premiums will be consistent with other people without those necessarily pre-existing conditions. It's all going to, it's typically, everybody asks how you're going to pay for it, but it's going to be premium credits and tax credits, and there's going to be associated with some tax penalties for those people that do have, say, the financial means but choose not to seek out that coverage. But I think that's time will tell on how that's going to play out and how these navigators are effective in terms of getting people enrolled.
Well, and I know I drove by the hospital this morning coming to the conference, and I saw the crane was up and they were delivering stuff, and fence was up and everything else. So we're deep in the middle of construction now.
Construction is a good thing. So construction is a good thing.
How long do you think before building's actually up and operational?
I think what we're going to see, you're going to see some steel come up here in the next probably 3 to 4 months, and then you're going to see the outer walls go up about a couple months after that. But really, we're probably looking mid next year to where we're actually moving into the building. With construction, you get that steel up, and people's like, okay, we're in the walls. You get the walls up, and they're like, when are we moving in? Well, there's a lot of things that have to happen inside for us to make it a safe, good place for people to work. So,
and just to talk about the growth that you have in the hospital, most everybody that has been to the hospital knows that we have one big parking lot out in the front, but now we're going to have a parking lot just for the people that work at the hospital.
Oh, yeah. We're adding just over 180 spaces to the hospital campus. It's going to be in the back of the new medical office building. And that's going to primarily be used for staff parking. And, it's going to be staff parking because it's going to be in the back of the hospital, but it's going to also open up the entire front hospital parking lot for patients, so that allows them easier access into the facility.
Well, we thank you for your time, Derrick. Derrick Cuenca, CEO, Lake Granbury Medical Center.